Welcome to this talk, and I'm very pleased to welcome Brianne Dressen all the way from Utah. Brianne, thank you very much for coming on.
Oh, thanks for having me.
And now, you have suffered greatly over the past few years, so it is a noble thing to share that. So anything you share with us, we will appreciate. So maybe, I think it's probably worth noting, actually, just before we start, there's been quite a lot of publicity this week. You've been in the Times in the UK, you've been in the Telegraph in the UK, you've been in the Daily Mail in the UK, you've been on Bloomberg internationally. So, you know, your story is getting out there, which is encouraging. But what is the story, Brianne? And maybe if you start off with a bit of a timeline, just take us back a few years.
Well, I guess we can start at the beginning, back when life was normal. For me, before my situation I'm in now, I was a healthy mother of two young kids and a preschool teacher. My kids were 6 and 8 at the time, and everything I did was for them. I took them to soccer practice, took them to, gymnastics class, and helped out at their schools, and made sure that they, had someone there to comfort them if they scraped their knee. And my world and my husband's world revolved around our kids, just like a typical young family. I was healthy and, did rock climbing and skiing and snowboarding. And 3 weeks before my life changed, I hiked a local mountain here. It's called Mount Timpanogos, and it usually takes 9.5 hours on average to do. And I did it in 7 hours. Like, it was no problem. So,
Wow.
so I was in good shape. And so when the pandemic hit, I did all of the things that that the science and the media was telling me to do. I did the social distancing. I made sure that my kids were wearing masks at school, and we live in a place where people didn't like wearing masks and put masks on their kids. So we definitely were the odd man out for sure. And it was really just because we still do live by our beliefs, right? It doesn't matter what our community or anybody else says. If we feel that it's right, then we do it.
Yeah.
But because of that, when the call came to roll up my sleeve to get my COVID vaccine, it wasn't a question of if I was going to get it, it was a question of when. So I felt privileged to be able to be part of the solution to get us all out of the pandemic. And I enrolled in a clinical trial for AstraZeneca here in the United States. So that's kind of the beginning, the start of how this happened.
This is 2020, is it?
This is 2020, yeah. So I went in for my one and only COVID vaccine on November 4th, 2020. And when I went in, the test clinic was very thorough in reviewing the contract with me. And I felt very confident going into it because of how the contract was written and how thorough they were, because they went through every single page with me and they helped me understand exactly what side effects they had seen so far, which at the time there was a case of MS in the UK that they had unraveled. Of course, they said, but that wasn't from the shot. So I wasn't too worried about that. But they did say GBS was another complication. And
Guillain-Barré syndrome. Yeah.
Yeah, Guillain-Barré. And so it seemed, like it was not going to be a big deal. I had never had any issue with any previous vaccine. So, yeah, boy, was I wrong.
And these side effects were put forward as being remarkably rare. They were just being mentioned for completeness.
Yes, extremely rare. So, and the list wasn't very long at all. But this is what's interesting to me is this was towards the tail end of the phase 3 clinical trial for AstraZeneca. At the very end of November, Pfizer started rolling out to the public here in the United States. So my suspicion is AstraZeneca probably knew more at that point in time than what the informed consent document showed. But that being said, because of those side effects that were listed, I did take those side effects seriously when I did end up with side effects.
Yeah. So, of course, the AstraZeneca vaccine was never authorized in the United States, but a lot of people in the United States, like yourself, stepped forward to take part in the phase 3 clinical trials to test its efficacy and its safety, which at the time, of course, we believe was a philanthropic thing to do. This was how it appeared we were going to get out of the pandemic at that time.
Yeah.
What happened when you got the shot, Brianne?
My shot, it's, my reaction, it started right away. It started within an hour of my injection, and it started with tingling down the same arm as my injection.
Yeah.
And I thought it was strange because it's a very foreign sensation. It felt as though I had fallen asleep on my arm for hours, right? It's that painful, sharp pulling sensation that's a little bit electrical and numb at the same time. That's what it felt like. And I thought it was odd. Later that night, my vision had become blurred and double. And then that night, I had a typical vaccine response with the fever and everything else. And I was like, oh, I definitely did not get a placebo. It was very obvious with that reaction.
Yeah.
And then when I got up to get ready for work the next day, my left leg was slumped, and I was always walking into the left doorways. For some reason, it was always to the left. I didn't have dropped foot. It was more like my entire leg was sagging. So that day at school, my cute little preschoolers, I remember telling them, oh, your little voices are so loud today. But it really wasn't them getting louder. It was my sensitivity to sound ramping up as the day progressed. And by the end of the class period, I had the lights turned off in the classroom, and I had the kids parked in front of a learning channel in front of the TV, and I was just holed up in the corner waiting for the parents to come get them. So that was the last day that I taught. And then over the next 2.5 weeks, the symptoms just kept piling on. Tachycardia, bradycardia, limb weakness. I lost control of my bladder. I had this severe, that pins and needles moved from the one arm through my chest over to the other arm. And then it moved from my head all the way down to my toes. And then it just turned into this nightmarish electrical surge over and over through my body all the time. It was so bad that I couldn't eat. I couldn't sleep. The only thing I could do was remind myself to breathe. And from then on, it was just kind of like this, I mean, not to be dramatic, but it was just unrelenting torture. And it's still there to this day. All those symptoms are still there, other than the sensitivity to light and sound are gone now. Everything else is still there. I've just figured out how to manage the symptoms to bring the severity down enough so I can think, I can eat, I can have conversations. So
you've got this constant sensation all over the surface of your body all the time.
Yeah, it's actually, it feels like it's inside. It moves with my heartbeat. So it moves in and out from my heart all the time. It's the most foreign and unnatural sensation, that I've ever experienced in my life. And it's just insane that I am plagued with it every moment of every day for the rest of my life. Yeah, it's not fun. And the other people that I know that have been injured in a similar way from AstraZeneca, I feel their pain. I know exactly what that's like, and I wouldn't wish it on my worst enemy.
So this is actually a constant pain. It's not just the discomfort, it's actually painful.
Yeah. It's painful. It's a prickling, stinging, pulling sensation. And it feels like it's teeny tiny nails moving in my veins. Comes from the heart, moves out, and I can feel every single beat that my heart beats because of this moving in and out. It was in my head at the beginning, in my brain, and it was so bad that my eyes would vibrate like this and I couldn't see hardly anything. It was bad. So that's gone too. But it's still, everywhere else in my body.
I mean, I'm just stunned. I mean, let's go back to the first week or two that you had this. How did you sleep? How did you eat? How did you do anything?
I didn't. I mean, I've got to be totally honest with you. I mean, it almost put me 6 feet under, and that's not an exaggeration. I had a plan. I had everything, set up because all I wanted was relief. It wasn't that I wanted to be done. It was just I needed a break, and there was no break that would ever come. So I just needed to be done. And so, yeah, I had a plan. And the only reason I'm alive, to be totally honest, is because of my supportive husband. And he recognized the signs right away, and he didn't leave me alone for even 5 minutes for months while this was going on. And it's not like I was pacing around, like telling people I was going to do it or whatever, but because of his training, he knew the signs and what to watch for. And as soon as he saw it, he had contacted a therapist and was like, what do I do? And so when he would go to the store or if he needed to go into work, he had someone come in and sit with me in the dark.
You
So
just felt you had to be out of this constant, the
yeah,
word
I just
torture.
needed an escape, and it really breaks my heart because I didn't talk about it at all for a long time, right? Because it's embarrassing, right? Because nobody wants to feel like they are that weak, that they can be brought to their knees, to the point
Heck
where,
no,
you know what I mean?
anyone can.
Yeah. And it's,
The level of suffering is terrifying, and
yeah. But what finally got me to open up was a really good friend of mine who's dealing with near identical symptoms from Pfizer. She ended her life, and that was in May of 2021. And that was,
what sort of reception did you get from the doctors you reported this to?
well, they all wanted to know what the drug company had to say about it because they figured the drug company would know what to do about it. That was the first thing they all asked. Well, what does the drug company say?
So
What do they
this
think?
was outside of the doctor's experience. I mean, I've never heard of anything as terrible as this.
Yeah, yeah. And it's interesting because there were a couple of doctors looking back through my medical notes that knew that this was a neurological complication to a vaccine. So they must have seen this type of reaction previously.
I mean, just listening to what
So,
you've said, to me, it's obviously a severe neuronal inflammation that's being described. I mean, that is clinically,
yeah,
that seems
yeah,
fairly obvious. Yeah.
yeah. And
So,
that's
so
really
that
what,
at least your doctors took you seriously to begin with.
well, a couple of them did. Most of them did not. So when I was admitted to the hospital because my legs were noodles, and I was incontinent, and the severity to light and sound was so bad that I lost 10 pounds in that first 2.5 weeks. Um, the the neurologist, they gave me a bunch of drugs to try to tamp down a silent migraine, and I was like, okay, let's see if that's what it is. So they drugged me up really good for 3 days, and then of course the medications didn't do anything because that's not what it was. And I remember the lead neurologist came in and she sat down and she looked at me and she said, COVID's a really hard time. And we think you just got really stressed out and then you went out and got this vaccine and you just kind of had a mental breakdown. So, and I have to laugh about it because it's so
This is a
ridiculous. But at
neurologist
the
saying, and
time,
this is a neurologist, a physician.
yes, like one of the best in the state, right? And so they didn't do a spinal tap. They didn't run any, I didn't even get an MRI while I was in the hospital. I got a CBC blood panel and that was it. Like super simple testing.
This is all in
And,
your head.
but
You're just gone a bit nutty, Brianne. It's just unbelievable.
yes, yes. And so the team with all the follow up, they kept saying, well, if you talk to a psychologist, and so they actually convinced me that it was anxiety because I was like, oh, these are the professionals. So I went to a psychiatrist, and the psychiatrist did a neurological eval because he was board certified in neurology. And he said, I don't know what this is, but it's not anxiety. There's something going on in your body. And so he sent them a letter too and said, hey, you guys need to help her. They still wouldn't help me. And then the NIH got involved, and the National Institutes of Health in January 11th, 2021. So if you think back about where you were in January 2021, the world still largely had yet to get a shot,
Yeah.
right? Most people, there were people in the US that were just barely starting to get it. Um, and the NIH was very interested in this reaction. They were very concerned that it was in the clinical trial with AstraZeneca. And they started a study that day And they tried to work with my home neurologists that kept persisting it was anxiety. And the NIH said she needs IVIG, she needs plasmapheresis, she needs some immunotherapy to stop the cascade of the reaction. And my medical team at home refused. So the NIH took pity on me and flew me out. So I was in Bethesda, Maryland, and at the facility there, and they did the top of the line testing, evaluation, treatments, and I got IVIG there, and I went from bedbound to being able to walk around. And I have the data actually on my Apple Watch. My walking heart rate was being tracked on my Apple Watch, and I didn't know it at the time. And it's interesting because it's nice and low when I was, before I got my shot, and then it shoots up literally the day I get my shot, and it stays high until I go to the NIH, and right when I get IVIG, then it goes back down.
This is the intravenous immunoglobulin that would hopefully damp down
Yeah.
the
And
reaction.
there's not a whole lot of research out there on this, but so they're not sure if it's just expanding the blood volume that's doing it, or if it's actually calming down some type of autoimmune cascade that's triggering these postural, orthostatic type symptoms. Either way, it worked in my case, and there was documented evidence, to show that it was effective.
How,
So,
what level of relief did you get from this appalling all over body pain sensation?
so at the beginning, it was a 10 out of 10. And after my first couple of runs with IVIG, it brought it down to about a 6. And so now it's sitting at a steady 4 or 5 right now. So yeah, so it's bad enough that it definitely is something where I still have to have a lot of willpower to mentally to cope with it, be okay with it. But to be able to coexist with this situation, so then I can be present for my kids, so I can be present for my husband, for myself too. Um, the worst place for anyone that's injured is when you're trapped inside your own head with nothing to think about but your own painful sensations going on, whether it's the heart rate fluctuations, the tinnitus, the joint pain, nerve pain. Um, that's the worst place to be. So being able to connect with others has been a really wonderful way for me to be able to get out of that situation in my head.
What you're describing is probably the worst syndrome, either as an adverse reaction or as a medical condition I think I've probably ever heard of. It just sounds. I just can't. I just can't. I'm really struggling to just imagine how you're functional. It's just amazing that you can.
It's
Yeah.
hard, it's there's a lot of people that they've ended their lives because of it. I'm really, 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 really stubborn, and there is no way that I'm going to let the drug companies have more of me than they already have. And so I've done a lot of mental work to be able to figure out how I can compartmentalize. But I will be totally honest, I still have days where this overwhelms me, and I need to, go through the cycle of grief and letting those feelings move through my body and my mind. You can't just let it all build up. It's gotta move through you, And so, and that's something that's, things that we can learn from other people that have dealt with complex chronic illnesses for hundreds of years, thousands of years. That is not new. Learning how to cope with chronic pain and extreme discomfort is something that people have been trying to figure out for a very, very, very long time. And right now, this seems to be working for me for the
Yeah.
most part. But it still doesn't mean that I'm happy with the situation or I'm okay with the situation. But it just means that, I'm able to do things with the limited time that I have other than sit in silence and
So
suffer
to have
by
pain in
myself.
one part of the body is one thing, but you've basically got it all over all the time. This is just. Yeah.
Yeah. Yeah. It feels like I'm rolling in cactus all the time. It's just, it's, yeah.
And I'm
So
just so sorry you've had to go through this. It's appalling. It's just,
thanks. I'm not alone. That's the more frustrating part for me because I was in the clinical trial. So there's a part of that where it's like, okay, I signed up to discover what this drug could do. And now I know very, very well what this drug can do. And the drug company does not want to tell anyone what this drug can do. And in subsequent order, now there's thousands, if not tens of thousands of people like me that are dealing with the same thing. And they had no idea. They had no idea this could happen to
and
them.
actually, that's the main reason for doing this video, I think, because people that are suffering in isolation will watch this and realize it's not just them. This is a group of people all around the world. People are not suffering in isolation. And I don't know if that helps, but I think a
Yeah.
lot of people certainly say that, they appreciate the fact that they know they're not isolated anymore.
Well, that's a really important point, right? Because chronic pain will rob everything from you, right? It'll rob your
Yeah,
sanity, it'll rob your dignity. Um, but there is a certain comfort, a certain degree of comfort that comes from understanding that there
yeah,
are people out there that get it. And for the people that are like me, totally get it. But then I also have this just profound love for people in my situation, because I understand that most of the time, that's the only thing that they can get, right? That will actually be able that they are able to receive. And I'm hopeful that every single one of those people has loving, patient family support. That's probably one of the most important things people can do as caretakers is to just be there and just be there in love. That's it. Um, it's such a simple thing that we keep forgetting, but there's healing power in that too. There really is.
absolutely. So the AstraZeneca trial, it consisted of two vaccines, I believe, and you only had one. So
Yes. So I got AZT 1222.
right,
I
that was
think
the
there's three
batch.
twos in there.
Yeah.
Mhm.
So obviously you didn't have the second one. And presumably, as far as you know, what was this adverse reaction included in the end of trial data? Do you know that?
As far as I know, I couldn't find myself in there. So the New England Journal of Medicine published
Yes.
the AstraZeneca clinical trial data. It was released in October time of
Sounds about right,
2021, I
yeah.
believe, maybe September. And there's two interesting things there. One is they say they follow all adverse events for 730 days. They stopped tracking my data at day 60. And the other thing is that they say that people dropped out, that people opted out to get instead of getting the second dose. So basically saying that the clinical trial participants that didn't get the second dose, they're all dropouts. They just, and they're lost to the system. There is nowhere in the report that shows why they dropped out. So there's some really key pieces of information there that's missing specifically from the AstraZeneca clinical trial report. After meeting other clinical trial participants, namely the kids clinical trial for 12 to 15-year-olds, Maddie DeGarry was injured in that trial. Same thing there. She's coded as a stomach ache in that report. Moderna, Olivia Tessiner, she's a clinical trial participant for the Moderna clinical trial in the United States. The report there shows that she had a minor shoulder upset. She ended up with severe lymphadenopathy, and that's basically where you have, your lymph nodes are the sizes of golf ball or softballs, and they needed to be surgically removed. She now has T-cell lymphoma. These are all things that are a little bit different than what is being shown in these clinical trial reports.
So basically, you're just a dropout, as far as you know.
Yeah, I'm a quitter.
So your adverse reaction may well not have been in that final paper, or we don't know that for sure. But if you're classified as a dropout,
We don't know, but we sure, yeah, classified as a dropout. And just to be very clear, very specific, while I was in the hospital, I was unblinded. So the clinical trial company that works for AstraZeneca called me personally and said, "You are correct. You got the AstraZeneca COVID vaccine because of your severe reaction. We are telling you to not get the second dose." So they told me not to get
so
it.
they dropped you out rather than you dropping out.
Correct.
And you were due, they did say for sure they'd follow everyone up for 730 days, a couple of years, and they followed you up for 60 days.
Correct.
No follow up after 60 days.
No, they couldn't get away from me fast enough.
How do you contain your anger? Because I'm feeling,
Um,
I'm just
it
outraged
comes
by
out,
this. But you're the one that's suffering.
and but the thing is, okay, chronic illness, your emotions impact your health, right? And it's not like it's just kind of interconnected. They are so intimately connected. It will throw you into a tailspin. You hear it all the time with people that get diagnosed with terminal cancer and then
Yeah.
boop, they go fast, right? Um, and I understand that. But I have kids here that look at me every single day. They are watching me. They are seeing how I'm dealing with this. They are seeing, is mom going to let this overrun her? Is she going to take this laying down? Those, seriously, those are the lessons I do not want to teach my kids. So I deal with my anger in healthy ways when it comes up, just like the grief does. Um, and yeah, I have a potty mouth, and it definitely has gotten worse because of this. But um, I cannot let the anger consume me. That's probably the worst thing I can do for myself and my family.
And it's love that's keeping you going, love for your family, love for those that are suffering.
Yeah, absolutely, 100%. 100%.
Tell us about the legal action, Brianne. How did that start and what's happening?
So, according to US law, there's this little
Yeah.
law called the PrEP Act, and the PrEP Act provides incredible immunity to not only the drug companies, but to the doctor that put the shot in your arm, the pharmacist that's involved, the nurses that see you after your reaction, the federal health officials that may or may not help you, which we all know that they're not helping. But because of this, it's been incredibly frustrating for everyone that's injured by a COVID vaccine in the United States to know that there is absolutely no accountability coming for what's happened to them. So that's been our clear understanding after talking with all of the vaccine injury law experts nationwide. And I just happened to come across a law firm that works with vaccine injury law that they took a look at my contract, and they noted in my contract that AstraZeneca agreed to provide medical and financial help in case of a research related injury. And it literally says, so long as I didn't cause the injury to myself, which I don't think there's any possible way I could cause this to myself. I've never heard anything like this before. So, yeah, so they said, you know what, we think there's a clear pathway here, not through typical vaccine injury law or tort
Breach
cases,
of
but
contract,
through
yeah.
contract law. So
Yeah.
breach of
I
contract,
mean,
yeah.
to me, as an outside observer, it seems patently obvious the contract was breached.
Yeah, and if there's anyone that's curious about that, the complaint is written and
Yeah.
it's online now, and that is exactly what happened. There's No emails missing. There's nothing, there's no context being pulled out of place. It's literally from the beginning. The drug company was poof gone, and the test clinic was trying to mediate as well as they could between the drug company and me. They were reassuring me that payments were coming, that the help was coming from AstraZeneca's medical team. And then after several months, then it was just radio silence from the test clinic as well.
And you've had no help
So
or compensation from them at all?
I did get a settlement letter. I got one settlement offer, and it was over a year after my injury. The only reason I got this settlement offer was because a reporter reached out to AstraZeneca asking for a statement in my case before they ran a mainstream story. And they told her, oh, yeah, we're working with her on that. We're just waiting for her response. And literally, either while they were talking to her or right after, they emailed me a settlement letter for $1,200.
Sorry, did you
While
say
that came into my
$1,200?
inbox, I literally 1,200. Well, it was like 1, 2, 3 something, so it was a little over $1,200. I mean, to be
I
fair.
mean, that's
So at the
that's only
exact same
designed to
time,
insult you. It's not a serious. I mean, it's just it's
yeah,
just
yeah.
preposterous.
So yeah, for the first half of my injury, the first half of the first 6 months of my injury, I couldn't understand why the drug company was ignoring us and not helping us at all. And I was like, well, maybe they're just really busy with that pandemic. Like I gave them so many like reasons and excuses in my head because I couldn't really wrap my head around them being this corrupt, right? Or this dismissive, especially with the contract that they signed. But then after that letter came, the settlement offer came in, and they misspelled my name too, by the way. Um, then I finally realized that these guys are not anything, they don't share any of the same qualities that I do as a preschool teacher that just wants to do my part. So my husband got the email because I was getting infused with the medication, actually the IVIG, and it cost me $3,500 every 2 weeks. So I have to get it twice a month for life. It costs $3,500 every time I get it. And so my husband snapped a photo of me in the infusion chair, sent it back to him, finally, with like a lovely email of like, I can't believe you guys, like, this is ridiculous. And then he just finished it with something like,
Yeah,
now I'm mad.
yeah.
So,
So what's happening now? What's the next step in this?
well, the lawyers have filed the case, and we are trying to get as many people to talk about
Yeah.
it as possible. We're using this as an opportunity to help shine a light on these very serious and important issues with the clinical trials. These are issues that we've learned is not just exclusive to the COVID vaccine trials, and we want to make sure that um, this process is improved, which unfortunately, because there's no accountability or no pathway whatsoever for accountability, that can't happen right now.
And
So,
what sort of prognosis have the doctors given you personally, or is it impossible to say because they've no experience of this? I mean, have they any? How's the future looking?
so it sucks to look at that for sure. My neuropathy is
Is
for
it?
sure progressing.
Right.
It's something, yeah. So at the very beginning of my injury, I got a small fiber neuropathy test, which I'm not sure if they even do those very often in the UK.
Yeah,
It's specialized here as
specialized
well.
investigation.
But basically,
Yeah,
okay, yeah. So basically, what they do is they take little
yeah.
skin punches out of your skin usually on your legs, and they put it under a microscope and they check the fiber density to see how many nerves, small nerves, are in the sample. And by doing so, they can test and see if your nerves are dying, right? Or if they're still intact and healthy and working. So at the beginning, my nerves were fine. And I got my skin punch biopsy within a couple of weeks. My small nerves were fine. My EMG was positive at the beginning. Now, 3 years later, it's been redone. And now my small fiber neuropathy test shows that I do have small fiber neuropathy now. So it's my neuropathy is progressing. My EMG is still positive. I've come up with a really good immunologist, MCAS specialist, and one of the best neurologists for POTS, postural orthostatic tachycardia syndrome. And they both have done a litany of tests on immunology, autoimmune conditions. They're doing some genetic testing as well. And they've identified that I have a screaming problem with autoimmunity that is not defined. So it's not lupus, it's not one of these others that we can understand or recognize currently. And they said if I want to have a chance at all of getting on top of it and slowing it or stopping the progression, that I need to up my game and move from IVIG to a drug called rituximab. And rituximab is a mAb drug that essentially wipes out your B cells. And they use it in autoimmunity, MS type
Fantastic
conditions
stuff.
currently.
Just remind us what EMG
So,
is, Brianne.
EMG checks your
Right.
large fiber nerve testing. So of course
Yeah.
there's the small fibers, and that's how
Yeah.
you feel in your skin. It's actually wrapped around small
Yeah.
fiber nerves are in your heart. So if you have small fiber neuropathy, your heart does not beat, the best, especially as it progresses. It lines your gut and your GI tract. So people with the slowing gut motility, that could be a reason there. Small fiber nerves are everywhere. And of course, the large fiber nerves is much more what people think of, where,
Yeah.
my arm can move, right? My legs can move. So when people think of a disability when it comes to
Yeah.
nerve related issues, they do think of large fiber damage that, is easier to see because you'll be walking with a cane or in a wheelchair, those type
But
of
you've got both.
injuries. Yeah, yeah. So I've
I
got
mean,
I've
what
got
is
a
your
mix of
mobility
both.
like now? Can you walk on your own?
I can walk on my own. Because my neuropathy is progressing, the numbness is getting worse, and so I can't feel as much when I'm walking. So I actually fell down my stairs
Yeah.
about 4 weeks ago. My daughter watched. That was the worst part. It's just because I can't feel my feet.
Yeah, you
So
don't
now
know where you're
I'm
putting your feet.
watching
You can't
that,
feel where you're
right?
putting them.
Because
Yeah. Yeah. Yeah.
yeah, yeah,
Yeah.
like I have elderly
Yeah.
parents. I understand how that goes. So now I'm like, oh, well, I'm young and definitely in senior citizen mode. So I need to be aware of those types of hazards just around the house now. So I cut open my hand pretty good, sprained my ankle pretty bad. Had to call my neighbor in to help. So that's the new reality, right? I mean, there's no certainty in any day. It's you don't even know if you're going to get out of bed one day to the next.
I'm
So
just overwhelmed by the severity of the sensory symptoms, though, that you've got this feeling all the time. It's just, how would that be? Fortunately for most of us, it's beyond our ability to imagine it. But you're living with that, and I just think it's amazing that you're able to be as functional as you are. It really is quite mind blowing.
it's either that or I let it swallow me
Yeah,
whole and I die. For real. Those are
yeah,
it's two choices, and I don't have a choice. I've got kids.
yeah. Well, let's hope this reaches lots of people, Brianne. I suspect it may do. There'll be a lot of comments, and people will recognise components of what you say. I recognise components of what you say from many other people, but the level of severity you're describing is just another order of magnitude, really. So, myself and everyone watching this, we're just so sorry you've had to go
Yeah,
through this level of suffering, and basically it's all been unnecessary as well, which is the irony of it.
yeah. Like had society been able to learn from my case and
Yeah.
make the products safer, inform other people so they
Yeah.
can get intervention
Well,
earlier than I did, then
I mean, the
that
trial
would have
should have been
made that
stopped
more
at the
worth it,
time, and that
right?
should have been it, as far as I'm concerned. It's just that carried on with the level of.
That conversation happened in the test clinic, actually, in my first
Yeah,
evaluation after my reaction. So they said, oh, you need to go make sure that this isn't MS, because it's not MS, then we need to make sure that AstraZeneca knows, because they'll probably have to put it back on hold. That's
it sounds
literally what the
nothing
test
like
clinic said.
MS. Nothing like MS.
So
I've never met anyone with
yeah,
MS with overall sensory sensation. I've never.
yeah, it's true. And I mean, I don't have MS, but I think I would rather take a test drive with that
Sure.
one, because you're numb. Your limbs don't work the way you want. It's different. I mean, I'm sure you can imagine sitting down at the end of a busy day and you just want to relax and unwind. There is no relaxing or unwinding for me, period. When my kids sit next to me, to
You can't. You
relax
can't.
and
You
have some
can't
time with
relax.
mom, and they're thrilled, right? And I
You've got
can't.
this
I
constant
pretend.
pain all the time.
And yeah, I'm good at pretending. That's what moms do, though. Moms are good at pretending. But yeah, it's not an easy way to go. It's not an easy way to live.
Brianne, thank you for sharing this. Really appreciate it. And obviously, anytime you want to come on and give us an update, you would be more than
Yeah,
welcome.
anytime.
We wish you the best for the outcome of the condition, and by some miracle, let's hope it can improve. I mean, I know the prognosis is not good at the moment, but
Well, I'm hopeful, just like you, I'm hopeful that as we start to push this whole
yeah,
issue in the direction of acceptance, that we can get more and more eyes on this and solutions to come.
yeah,
I'm hanging on, you know,
yeah,
with an iron
yeah,
fist actually for that. I am hopeful that maybe the rituximab
yeah,
does, knock this down so it's, really not so bad. There's all kinds of other therapies that people can try too. There's PEA supplement, palmetto little, big long word, but I can send you a link to it. But it's incredibly helpful for nerve pain. I've tried all kinds of medications for nerve pain, and none of them touched it. Right? Gabapentin wasn't for
if
me.
all the standard things, the amitriptyline, the gabapentin, the progabalin, all that
Yeah,
kind of
all of
stuff.
them, right? And they all have like a laundry list of side effects that make you a zombie. So the PEA has helped dial that down quite a bit. The food,
Those standard neuro pain meds didn't make any difference.
no, not for this. No. It just it just made me like a stoner is really what it felt like. Like I was just not with it at all. So, but yeah, the food modification, I'm sure you've heard that before, was huge. So I cut out gluten, cut out dairy and corn, soy, and a couple of other things that set me off. And that's helped significantly. I want to say, even without the IVIG would do absolutely nothing for me if I didn't clean up my diet. Um, and Americans, we eat terribly anyway, so I was doing myself the favor there. But it's dramatic. It helps with my brain fog, food sensitivity issues, also obviously, but the GI issues, the skin issues, the nerve pain, and the vibrations went down as I changed my diet.
Yeah, I mean, what we need, of course, is massive international research into this. Everyone should be collected into a cohort. The best, we need a Manhattan Project
Yeah, that would be amazing, right? I mean, and on that,
to attack this.
yeah, and on that note, because just as well as I do that there's a lot of people that are out there and they're not going to wait around for someone else to figure it out, right? So that's kind of one of the things that we do at React 19. It's a patient advocacy organization that I co-founded, and we have a study that's IRB approved that we're running right now, with in partnership with the University of Maryland, and we have 1,000 people that have completed the study so far, and it's open for another 1,500 people. So this study, it asks all kinds of questions, asks about symptoms, tests, diagnoses, and most importantly, treatments that people are trying. So right now we have over 1 million data points on different therapies and diagnoses and tests that people are using to pave a pathway forward for their own improvements, their own recovery. And obviously the goal of this is for us to figure this out ourselves. We can't
Yeah.
wait around for other people to do it. So we're going to do it ourselves. I'm really encouraged and excited to see what the data is showing so far. We're about to release it in the German language and French language next. And after that, we're going to expand to Spanish and Italian. So
Why aren't you releasing in English straight away?
I should. I need to. We definitely need to.
Finding someone to publish it, of course, is the
That's the goal. So we're going to try to be very strategic about how we get this published because it's got to be published, and we're being very careful and meticulous with how the data is managed to ensure that this thing will hold up to the scrutiny required to be able to get this type of information into publication.
yeah. Are you finding that particular therapies are good for everyone? There's certain things that help everyone,
No,
or is it different for every individual?
it's different for every individual, and that's why we're really wanting to look into what types of diagnoses people are having, put these people into
Yeah.
symptom clusters, and then also we need to also identify what their diagnoses are that they have, what types of tests they have, to see if we can then tie that to how people are having benefit, how some people are having, catastrophic effects, and see if we can start putting some of those pieces together. But of course, just one,
It really is just beginning, isn't it? The research. This is just
yeah. And this is something that's totally, we're doing it free. So it's as grassroots as it comes. We're just paying for the server that protects all the health information and maintains it. And
yeah.
everybody else is volunteering their time for it. These types of research,
So there's no money from big pharma going into this.
what a coincidence, right? It's going to be interesting to see if they will jump on at some point, maybe in 10, 15 years when they realize how much money they can make off of treating us. But they're not there yet.
Yeah. Brianne, thank you so much. Really appreciate it.
Thank you.
And do come back and update us literally any time.
Will do. I'd love that.
And on behalf of all the people that recognise that they're suffering similar things, thank you. They will appreciate this. I'm going to stop now. I'm just overwhelmed with what you've told me. It's just incredible. But thank you so much.
Yeah, anytime. I appreciate it. Thanks for being such a good listener. There's a lot of people, and I have family members too, that all of my family members have been very supportive and helpful, but I have one brother that just, he can't do it. Makes him uncomfortable. So,
For sure.
but I think that's
Yeah, I
what
can
sets you
understand
apart,
that.
really.
It's you that's done the suffering, Brianne. It's yeah. For now, thank you so much.
All right. Well, thank you. Okay. Try to have a good night.